You hear the term heart disease all the time, right? But what does it actually mean? Turns out it's not just one single thing, and today we're going to break it all down and give you a super clear and simple guide.
So let's just jump right in with the big question. When someone says heart disease, what pops into your head? Is it just one specific illness, or is it, something bigger?
And right there, that's the key. Heart disease isn't a single diagnosis. Think of it more like a giant umbrella term. It covers a whole bunch of different conditions that can affect your heart structure and how it works.
So under that big umbrella, you've got all sorts of stuff like heart rhythm problems, issues with the valves, even infections. But the one you hear about most often, and the one we're really going to focus on, is cardiovascular disease. That's the big one.
All right, so let's talk about cardiovascular disease. This is so important to understand because, honestly, it's the root cause of some of the scariest and most sudden medical emergencies out there. So what is it really? Well, at its core, you can think of cardiovascular disease as basically a plumbing problem for your body. It's all about your blood vessels. They're like the highways for your blood. And when those highways get narrowed or totally blocked, well, the blood just can't get to where it needs to go. And that could be your heart, your brain, or anywhere else.
So you might be wondering, how does a blockage like that even happen? It's not an overnight thing. It's usually a really slow, gradual process. See, it all starts with these fatty deposits, what we call plaque, building up on the inside walls of your arteries. And over years, this makes the pathway for the blood narrower and narrower. Then, one day, a clot can form and bam, a total blockage. And that is the exact moment a heart attack or a stroke happens. And here's the really scary part, the thing that makes cardiovascular disease so dangerous. For a lot of people, there are zero warning signs, none. The disease can be totally silent for years, right up until the very moment a heart attack or stroke hits. That emergency event, that's the first symptom. It's wild.
Okay, so because it can be so silent, this next part is, well, it's absolutely critical. I mean, if the emergency itself is the very first warning sign, then knowing what that emergency looks like could literally save a life. So please, pay close attention.
Let's put these symptoms right next to each other, because they're really different. For a heart attack, you're probably thinking of that classic, crushing pain in the center of the chest, right? And it can spread to your arms or jaw. But now look at the stroke symptoms. They're all about suddenness, and usually on just one side of the body, like sudden weakness in an arm or trouble speaking. Oh, and this is super important. For women, heart attack symptoms can be different. They might not have that classic chest pain. It could be more like shortness of breath, nausea, or even back and jaw pain. So what's the big takeaway here? It's simple. If you or someone you're with has chest pain, shortness of breath, or faints, those are massive red flags. Don't second guess it. Call for emergency help right away. Seriously, do not wait.
Okay, so cardiovascular disease is obviously a huge piece of the puzzle, but it's not the whole story. Remember that umbrella? Let's do a quick tour of a few other conditions that fall under it, just so you have the full picture. All right, first up, cardiomyopathy. Now, if cardiovascular disease is the plumbing problem, think of this as a problem with the pump itself, the actual heart muscle. This disease makes the muscle get all weak or stiff, and when that happens, it just can't pump blood around your body the way it's supposed to. And that's why people with it might feel super tired or short of breath. Their body's just not getting enough oxygen.
Then there's congenital heart disease. And the word to focus on here is congenital. That just means you're born with it. So this has nothing to do with diet or exercise. We're talking about a problem with the actual structure of the heart, maybe the walls or the valves, that was there from the very beginning, before a baby was even born.
And last on our quick tour, we've got heart valve disease. Your heart has 4 valves, and you can picture them like perfect little one-way doors. Their only job is to make sure blood flows in the right direction. Well, with this disease, those doors don't work right. They might get leaky, or they might not open all the way. Either way, it messes up the blood flow and makes the heart have to work way, way harder.
Whew. Okay, so we've talked a lot about the problems, but now for the best part, the part where you get to be in control. What can you actually do about all this? Let's dive into prevention and talk about how you can take charge of your own heart health.
The first step is just knowing what the risks are. And the big ones, well, they kind of fall into 2 buckets. You've got the lifestyle stuff, things like smoking or what you eat, and then you have medical conditions like high blood pressure or diabetes. It's pretty straightforward. The more of these you have going on, the higher your risk is.
But here's the good news, and it's a really important point. So many of those risk factors are things you can actually manage. When you boil it all down, prevention is hugely about lifestyle.
Things like not smoking, eating a healthy diet, getting some regular exercise, and finding ways to manage stress. These are incredibly powerful tools. It really is about taking control of the things you can control.
And of course, if someone already has a heart condition, what does treatment look like? Well, it usually falls into three main categories. It almost always starts with those exact same lifestyle changes we just talked about. From there, it might involve medications, things to help with cholesterol or blood pressure. And for more serious situations, there are surgical options to go in and fix the problem, like a bypass or replacing a valve.
So, let's recap. We've learned that heart disease is this big, broad term. We've covered how to spot the signs of a true emergency, and maybe most importantly, we've looked at some really powerful ways to prevent these issues in the first place. So I want to leave you with just one question to think about. After everything we've talked about, what's one small step, just one thing, that you can do for your heart health starting today?